This education video will cover the ED flow sheet. This is where you will document what you see and do with the patient. Access to the flow sheets. You will access either through your patient list or your ED status board. Through your status board, you will right-click on the patient's name, choose Quick Launch Documents, and follow over to the ED flow sheet. This will launch your flow sheet for you. You may also click on your patient's name, choose the flow sheet tab. Once you click on this, it may take a minute to load. However, you will notice on the left-hand side of your screen that you will have access to all the flow sheets that you need. Simply single-click on your ED flow sheet and it will populate for you. We will now go over flow sheet functionality and documentation. You will begin by choosing the correct flow sheet on the left-hand side. Single-click and it will populate on the right. You may use an icon called Expand or Collapse Rows that will allow you to see all of the documentation at once, or you can simply open and close as you document. All of the documentation points are referred to as parameters. You will see these on the left, or headers. In order to document, you will need to right-click and choose the option of Add Single Time Column. Add Single Time Column means I want to chart now, and you will notice real-time populates. You will click OK, and now you will note that you have a time column that's going to allow you to document. You will left-click to get into the field in which you want to document. In the first example you see here, we have a WDL, or within defined limits. This basically allows for certain documentation points in order for the patient to meet them. When you chart, you will have a WDL or a WDL accept. It's one or the other. Either they meet all the criteria or they don't. And if they don't, you will document the criteria they don't meet below them. Moving forward, we have our vital signs. These are simply data entry points. You will choose the appropriate location if it is asked. Remember that your circle buttons are radio buttons or single select. The vital signs parameter will hold other data elements. These include your capillary refill, your positioning, and also your pain assessments. Some of your data points will have pick lists, as you can see here, and you will choose appropriately. Your positioning will provide a very lengthy pick list, so choose appropriately and if there's any level of assistance. Even if the patient is self-assist, please go ahead and document when they change their positions. You will also have your pain assessment scale. You will document your full pain assessment, location, their numeric number, their sedation scale if needed, any nonverbal indicators, and of course a description of pain. You will also come back in and document any response to any pain interventions. And there is a pick list that will be available to you. You also have a chest pain assessment. You will document this only if it applies to your patient. Only use the pain scale FLAC or faces if needed. The actions taken parameter has a lot of great documentation points. You have your SBAR communication. This will allow you to document any communication thoroughly. There are 5 documentation points to your SBAR. The first is the who. The second is the situation or critical results. The next part is your background and assessment. Your recommendation, so if anything was to come of your communication. And then your SBAR notification status, so if you need to track any call logs and so forth. There are interventions that can be done. We have an intervention pick list. There is an at bedside pick list. Here you can document your MD at bedside. and various interventions. If you send your patient to radiology, you also have any safety, so bed in low position, side rails up, and so forth. You have a treatment refusal parameter. Anytime the patient refuses any type of treatment, you will document here. And we also have a communication needs, so if you need to use an interpreter or you use our Stratus device, you will document here. Your general assessment parameter will allow you to document a quick general appearance assessment. This is outside of your head to toe. You have your sepsis screen. This is for a rescreen. Remember, your primary screen was done on your ED triage note, so if you needed to rescreen your patient, choose the appropriate age and it will populate to the appropriate parameter to further screen the patient. Again, you will get the same alerts as you did in your note. Your IV access parameter will allow you to document any initial starts and further assessments on your IVs that are currently in place. You will also document any time you discontinue an IV and the site assessment. You will note the WDL towards the middle of this parameter that basically states the line is intact without any symptoms. You may also document to any dressing and securement. Again, the WDL we spoke about. Any site signs. And then any removal, indication, or symptoms. You may add more than one line if that's necessary for your patient through the add parameter function. We have a patient transport parameter. This will allow you to document anytime the patient leaves the emergency room or if they are moved to another floor for an admit. It's important that you document who the patient was transported with and what they were transported with. If there is a space available, please enter the clinician's first initial and last name and credentials. We also want to make sure we document any belongings that went with the patient. We have a cardiac parameter. The WDL sits towards the middle of this area. Again, we chart by exception, so only document what is necessary for the patient. We have point of care testing. You can document your glucose, any urine pregnancy, any drips that you have on your patient. These are grayed out as they are DC'd. However, you would document your drip rates in those areas identified. We have a respiratory parameter that will allow you to document any WDL with this patient. You may document further assessments such as breath sounds, and the interventions are below for any tubes or O2 therapy assessment. Under neuro and stroke, this will only be documented to if the patient meets the criteria. However, you do have a cognitive perceptual neuro WDL. Pupils and Glasgow Coma Scale are also within this parameter. Any other parameters that apply to your patient? We have seizures, cardiac pacemaker. You have your GI assessment and an intervention parameter. You have your GU assessment and intervention parameter. Remember that your assessment is going to hold certain assessment key points, where your interventions are going to hold any tubes, drains, or further assessments. You have a head, eyes, ears, nose, and throat parameter where you can do an individual assessment on each one of these body parts. The IV Access Other is all of your central lines. Musculoskeletal is going to allow you to document ambulation and anything related to the patient's activity. Safety and hygiene will hold your safe patient handling plan and the education that you provided to the patient. You may also document to any fall occurrences within this parameter. Under hygiene care, you will be able to document any type of care provided to the patient, such as linen changes, bathing, shaving, a shower, as well as the assistant provided to the patient. You have an oral care section. You will also be able to document to any universal fall safety rounding interventions, as well as any anti-embolic interventions, such as foot pumps, ALPs, stockings, and so forth. Your skin parameter will allow you to do a full assessment with a WDL. You may also add any incisions or wound care, skin tears, abrasions, and so forth within this parameter to document appropriately. Pressure ulcers, burns, any skin assessment. The remainder of your chart will allow you to document against any other specifics with your patient, as well as education towards the very bottom of this flow sheet. You have the ability to use the Add Parameter function to add any other interventions that will be useful in documenting your patient's care. We will now discuss the blood transfusion documentation. It is important that when you are administering blood, and from a documentation standpoint, you add a single time column and only document to the blood transfusion parameter. This is due to the co-signing that is done within EMD. Once you have the physical blood unit in your hand, you will stand with another RN and verify this information. You will enter the stop date and time. Once you left click into this field, you will have an Insert Now button, or the clock, which will allow you to enter the current date and time. You may cancel through the next field, as this is the stop date and time, and we will come back to this. Enter the blood product. Enter the patient's blood type, the blood unit type, the blood unit number, the expiration date, the blood verification that you have verified that the patient's wristband and their results match the blood, and that you are going to assign a cosigner. It will prompt you into your filter or warmer, so go ahead and enter information if it applies, otherwise cancel. Ensure you document your initial set of vital signs. You're going to go over to your options panel on the left-hand side, and under the area that states Save Options, you will open this field, and you will note there is a cosigner box. Single click into this box, choose Other at the top, and enter your coworker's name. For this purpose, we will be using cosigning nurse. However, you will enter your coworker's name exactly as it reads. Choose the search button, not enter. Enter will erase the person's name. Make sure that you see their name populate. Choose Save, and then uncheck. It is so important that you uncheck this cosigner's name. If you don't, you will assign him to the remainder of your documentation for the rest of the day. For any follow-up vital signs, you will document them here in the blood transfusion parameter and not the vital signs parameter. When it is time to document the stop date and time, you will return to the initial time column and click into the already filled in parameter, document the stop date time, any reaction, and any reaction follow-up. The add parameter function will allow you to pull in any other interventions that you need to document against. Right-click, choose Add Parameter, and from this menu, you will note all of the addable interventions, or parameters. The bolded headers is where it will lie in the flow sheet when you add it. So if we look at the cardiac, wearable cardiac defibrillator, we highlight, choose Add, pulls to the right, you're going to click OK, and if I go and locate my cardiac parameter, I will note that the intervention parameter has been added. A few key points to remember. Chart by exception, meaning only chart to it if it was done or you assessed it. Chart in real time, meaning you want to chart as quickly as the intervention or the assessment occurs, and chart what you see and what you do with the patient. This flow sheet should capture all of the care you provide to your patient, in addition to your ED triage note.